to my lecture series. And since this is the Corona pandemic period, and I've been taking up the topics, the factors what are responsible for Corona, the COVID-19 patients. So in succession to those videos, today's video, what I'll be mainly focusing upon, see what is the criteria for the discharge of COVID-19 patients. So in the previous videos of mine, there I have discussed all about the stages of the COVID-19 and how the patient progresses from the milder asymptomatic form to the patient progresses from the milder forms to the moderate and then severe, and finally the patient is shifted to the intensive critical care unit. So what is there is that since this outbreak of the coronavirus, it is an emerging global health threat. So basically, most of the times the patients are very much concerned as to when are they actually needed to get discharged. See, it has been found that the severe patients of COVID-19, they are mostly treated under the ICU, while the mild or the non-severe patients, they are treated in the usual isolation ward of the hospitals. So it becomes a very important criteria to assess as to when the patients actually need to be discharged from the hospital. So in this video, I'll be mainly focusing upon the discharge criteria when the doctor is actually going to assess and send the patient back home. So beginning with, the first criteria what is there is, it is actually the patients who never needed oxygen. See, there are certain patients who have been tested COVID positive, but due to certain reasons, due to falling blood oxygen saturation levels, these patients, they are admitted into the isolation wards of the hospitals. So the first criteria which needs to be properly determined is that the patients who never needed oxygen. So the mild cases, there where the oxygen level has not fallen abruptly, where the oxygen levels are not declining to a very severe extent. So the patients who never needed oxygen, that is the milder cases, or who had low oxygen requirement. Even if these patients are administered oxygen, very low or mild oxygen levels are there. So, or who had low oxygen requirements but are now off oxygen. So the first criteria is that initially these patients might be requiring oxygen, but now the situation has improved and now the patient does not need any oxygen. So now the patient is off oxygen, and the patient is, when the oxygen saturation is being monitored, so while assessing, while the timely recording of the chart where the blood oxygen saturation is being noted down, it has been found that on a usual basis, the patient's blood oxygen saturation level is found to be always greater than 95%. So if the blood oxygen saturation level is greater than 95%, it can be, it is 100% now sure that the patient is more or less fit to be discharged from the hospital and he can be sent back home. If and only if the oxygen saturation is greater than 95%, this has to be the criteria. But along with it, the following, all the criteria what I'm going to discuss needs to be fulfilled. So the first criteria is that from the previous 10 days when the patient is being admitted, the previous 10 days have elapsed from the onset of symptoms. See, whatever the symptoms of COVID-19 was there and the patient was admitted. So from the past 10 days, the symptoms, what has been there, those symptoms have properly elapsed, and now as such, there are no that kind of severe symptoms. So this is the first criteria. Next, now the patient is clinically, the next criteria, what can be looked on for the discharge of such patients, it is that the patients have now improved clinically. So these patients have slowly and gradually they are recovering and they have become asymptomatic. So there are as such no severe signs of breathlessness, no dyspnea is there, even the temperature, they are not having fever from the last 4 days. So next, the criteria is that these patients who are where the doctor is assessing that whether these patients needs to be discharged, in that case, the fever, if we look at the criteria of fever in COVID-19, there has to be presence of no fever for 3 days without any need of antipyretic. See, mostly the COVID patients, they have been, the specific regimen of medicines have been prescribed, and these specific regimen of medicines, they comprise mostly the paracetamol. So it is an antipyretic. So before discharging the patient, while considering a patient for discharge, it has to be considered that the patient is having no fever since the last 3 days, and this this absence of fever is, the patient is not having any antipyretic, but still the fever is not there. So this criteria has to be very judiciously considered, that from the last 3 days the patient is not having any antipyretic and still the patient is not having fever, then the person can be considered that now the patient can be discharged and can be sent back home. Now, moving on to the next criteria, it is that these patients of COVID-19, the doctor must assess that there should be no breathlessness and no oxygen requirement from the last 4 days. See, even in the isolation wards of the hospital, the patients have been admitted for a continuous period of 10 days, 15 days, whatever. But during the criteria for the discharge of such patients, it needs to be judiciously considered that there should be no breathlessness, signs of no breathlessness should be there in the patient, and the oxygen requirement from the patient is not needing any additional oxygen requirement from the last 4 days. So this again becomes a very important point which needs to be considered. And last but not the least, do remember that the RT-PCR is not needed before the discharge. It is very, very important. Why? Because do remember, this RT-PCR, which is the diagnostic test which is being carried out for the detection of this COVID-19 virus, that is the SARS-CoV-2 virus, this RT-PCR is not needed before discharge, because even if the patient is healing, this COVID-19 virus, what is there, this RT-PCR can come out to be positive. How? Because even the virus has been killed in the body, there might be certain fragments of the RNA, there might be certain fragments of the virus which might be present in the bloodstream, giving a false positive result. So RT-PCR might come positive even in the healing, even in the recovering patients. So do remember, the criteria for the discharge of such COVID-19 patients, it is not a criteria. The RT-PCR is actually not needed. It is not advised for such patients to be discharged, and this report is not to be considered. This RT-PCR needs not to be conducted before discharging the patient, because there can be false positive results as well, just because the virus might be present, the RNA of the virus, the broken fragments of the RNA or the virus can give a false positive result. So the RT-PCR is not needed before discharge of these patients, and at the time of discharge, the doctor must advise these COVID-19 patients that they are going to isolate even after reaching home. Even when they are at home, they need to isolate himself or herself at home and self-monitor their health for the coming 7 days. So these are the must criteria which all of criteria needs to be fulfilled before considering discharge of any COVID-19 patients. Students or viewers, if you still have any queries or comments, you're most welcome to comment me in the comment section, and stay safe, take care, and always wear a mask. Thank you for watching.